Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to go over lunges, and performing lunges is part of your rehab and recovery after knee replacement surgery. Hi everyone, so today we're talking about lunges. And lunges are a really great exercise as part of either your prehab or your preparation for surgery, as well as of course your recovery after knee replacement surgery. They're a great exercise for strengthening of your quadricep muscles, those big muscles in the front of your thigh that can be very weak and inhibited after knee replacement surgery. They're also great strengthening exercises for the rest of your legs and lower extremities, for your glutes and your hips as well. And they're a good functional type of exercise. So if you think of a lunge position, it's more of a unilateral or a one-sided focus type of exercise compared to a sit-to-stand or a squat. And it's really good, for example, when you're trying to stand up from kneeling and you're coming from here and you're trying to use this strength in that leg to push yourself up on one side. Similar motion with a lunge is that one-sided type of focus or movement. Also things like going up and down stairs, walking up a hill, whatever it may be, there's a lot of exercises and a lot of activities where you're not necessarily symmetrical and pushing up equally with both sides, where you want to focus and emphasize more on one side than the other. So here's a couple of things for performing lunges. So first off, I highly recommend you have a stable type of environment. So having something to hold on to. So here today I have a chair. You can use a tabletop or a countertop if it's at a good height. I would recommend a lot of times having a chair, one on both sides, so holding on with both hands and then performing the lunge in between both of them. If you're stable and comfortable, you could also use, if you have like a stick or something of that, a pole or something of that nature to hold on to, that can be useful to use as well. Also, I would recommend starting out doing this on a hard, firm surface with sneakers, with shoes on. Today, I'm doing it on the carpet with my socks on, but just for some more stability, safety, I would recommend starting out with footwear and doing it on a firm, hard surface. So what you want to do with a lunge is the focus, at least initially, is not on how far you can go down. Going down and trying to touch that knee all the way down to the ground, that probably is going to be really tough initially, early on after surgery. We want to focus on good alignment, good technique with the lunge motion, and then progressively increase how far down we can go or how many repetitions, whatever it may be, increase that over time. So one thing I like to say is you really want to take a nice big step out before you're doing the lunge. I like to start with lunges in place just because as you start to do moving lunges or forward lunges, then you start to kind of introduce more variables, start to lose your technique a little bit. So I like to say take a big step out, probably a little bit further than you would almost think and feel comfortable. This is important because as you come down, that knee is going to track or move over your foot. And the more that knee moves over the toes or past the toes, that's going to put a lot of stress on the knee and make those quadricep muscles work very hard. That's not a bad thing, but early on after surgery, that might be a little bit difficult. So we want to take a little bit of that stress off and make sure the foot is pretty far forward. And then the other foot, of course, is behind you. And you're kind of in this staggered stance, staggered position. Hold on to the chair or whatever surface you have, and then you're just going to come down. You don't have to keep the back heel down. You can come up on the ball of your foot and your toes like this. And just come down as far as you feel comfortable, and then come back up. The goal, don't let that knee cave in like this or cave out too far. You want the knee to come right over the foot and toes. And I would just start with what we call partial lunges. So think about, if a full lunge is coming down all the way and basically just tapping that knee on the ground, then think about from there what would be 50% of that. So that would be a 50% or a half lunge. And then you can also do 25% lunge as well. So I like to start people out, start out with a 25% lunge. Try to do sets of 10, maybe 2 or 3 sets of 8 or 10 reps. And then see how you tolerate it and go from there and progress up. Maybe go down a little deeper, maybe go a couple more repetitions and see how you feel. Because with everything we do, you want to start simpler, start easier, and build up slowly depending on how your knee tolerates it and how you feel. Other things to keep in mind, you don't want your trunk and torso to lean forward or slouch forward. So a good cue, a good thing to think about is keeping that chest up. Like you have the headlights of your chest, and you want to keep them up and pointing forward as you lunge up and down. And then of course you want to be sure to do the surgical side and the non-surgical side. Something to think about, sometimes people will focus too much on bringing the leg forward. What you can do is almost think of like you're a stacked building or a bunch of blocks that you're stacked, your spine, and you're just coming straight down with that knee. And that's a good way to think about keeping a good straight back, good stacked back and hips as you come up and down. So almost focus on bringing that knee straight down rather than trying to lunge forward with your hips. And that starts to introduce some different variables. So again, to progress this, you can change how far down you're going. So maybe start with a 25% squat or lunge, and then do a 50% lunge. And then if you're really good, going all the way up and down. And then of course you can progress with how much you do, so number of sets, number of repetitions. And you can also start to add some weight. So probably the easiest way would be almost like we do with the goblet squat, holding that weight in front of you. You can also hold the weights, hold some dumbbells or whatever it may be at your sides like this. And then if you're really good, you can also do the barbell on the back, but that takes a good amount of control and technique. So probably I would say either do the goblet squat position or holding the barbells or the dumbbells at your side. All right, so that's lunges, a great exercise for working on unilateral strength and stability after knee replacement surgery. Again, a good one that you can progress easily. Progress by how far down you go, progress by the number of sets or reps you do, or you can progress by adding some weight, holding on to some weights as well. Thank you very much for watching, everyone. This has been the Need to Know Show. As always, be sure to subscribe, leave your comments, your feedback, your questions, and I will reply to you in a timely manner. Have a great rest of your day.